Next will be Convergent Dental with Dr. Ryan Slayton.
Good morning, everyone. Thanks for coming out today. I'm so excited to share with you a technology that has completely revolutionized the way that I've been practicing dentistry. And I think it's a game changer in our industry. You'll see why in a second. But first, I'd like to get a little group participation if I could. I know this is everyone's favorite part, but if you could please raise your hand if you've heard these words before from anybody. It might be a great friend, it might have been a new patient, but have you ever heard, I'm sorry, but I hate going to the dentist. I don't mean to offend you. Everyone's heard that, right? Why is that? Does anyone, can she shout out why? Fear of injections, right, shots. So shots are not a necessary part of dentistry anymore. And let me show you why. You've probably seen other lasers before, but this laser is completely different. What you've seen are erbium lasers that cut hard tissue. They do it somewhat reliably, sometimes unreliably, anesthesia-free. They work at a different wavelength. You've seen CO2 lasers that are native. This is an isotopic CO2 laser that works at 9.3 microns. And the reason that's significant is because hydroxyapatite, which is the main component of teeth, absorbs at that wavelength cleanly. So you get a clean cut with all the energy going to breaking the tooth. You don't get explosions because other lasers target water. And that causes heat, explosions, and of course, the discomfort that people feel. So aside from the wavelength, there's a unique computer-modulated technology that's very complex and sophisticated, but they make it very simple to use. And that's what I love about it. It's as intuitive as using an iPhone, really. If you look at the lower right, you can see there's an enamel, a bone, a dentin, and a soft tissue setting. And it can do all those things reliably with only topical for soft tissue and with no shots at all for hard tissue. In my practice, 99% of the time, you'll see in the end, the last time I gave a shot to remove an amalgam was November of last year. Over hundreds of patients have come and gone between now and then. So it can do all this reliably, virtually anesthesia, and for soft tissue, blood-free. And that's important too, because you need to see what you're doing. Another great advantage is you see in the handpiece here, you have a working length that's variable, so that because there's no tip on the contra angle, which is similar to the handpiece that you're used to, you can actually be as close as 3 millimeters or as far as 30 millimeters from the tooth, and you can aim the laser beam at the tooth in various angles. So if you're working on 2 or 15, say, it's not difficult in someone with limited opening anymore because you can come at it from another angle. The straight angle handpiece is used mainly for frenectomies, just to make it easier in the front, or lingual frenectomies under the tongue in small children. And it is possible to work on very young infants even. There's a doctor who only does lingual frenectomies on infants with only topical. The UltraGuide handpiece just came out recently, and that's for perio procedures. You can do traditional flap debridement and Lenap and that type of thing. So what you'll see here is a video of a class 2. This is done anesthesia-free. A rubber dam was used, and matrix band was used, although you don't have to. And you start it for me. So keep in mind, one thing I didn't tell you is the software is completely Wi-Fi upgradable, kind of like how your iPhone gets new software. They push new software to the laser. So what you're seeing here is actually an older version of what we call a spot size. Now the spot sizes come in 0.2 millimeters to 1.25 millimeters, so a quarter of a millimeter, which is very fine, of course, to 1.25. And we can do finer coarse cutting. And you'll see we're through the enamel layer in the old setting in about 10 to 15 seconds. In the new setting, I'll tell you, it's about twice as fast as of, I got it last July. And there's an even newer setting that's coming out that we've tested, and it's lightning fast on cusps. We're actually able to get through enamel in just a couple seconds. So just keep in mind this is slower than what I'm used to today. But it's still, I think, very acceptable and very quick and painless. You'll see that it is in fact the deep prep. He's using a finer setting now. Not as coarse of a setting, and he's doing that to refine the margins here. And So that's the extent of the preparation. Now, this is a very conservative preparation. We're able to remove multiple surface amalgams, multiple surface composites, again, anesthesia-free. And you can also use the drill in conjunction because through the gate theory of pain, we're actually causing this analgesic effect for 5 to 7 minutes. You maintain the effect. So you can actually use the drill, high speed or low speed, completely reliably. So this is a new patient that presented with multiple interproximal lesions. We focused on the largest one, number 3, the mesioclusal. Again, this is a more conservative example. And you can see that there was a coarse cutting done on the upper right there. And they use Carey's indicator. That's not carbonization. Although if you do get carbonization, you can use a different setting. You can completely wipe it out like you see on the Prep Complete slide. And this was all done with the laser, no refining with a burr, and you get very smooth margins, as you can see, even deep in the box. If it was subgingival, you can switch to the soft tissue setting, and you can actually remove the soft tissue to get deeper with your preparation, and you don't have to give any shots. So there's the final. I'm sorry, that was the initial. So here's the preparation, there's the final. Also keep in mind, because the patient wasn't numb, and this is something that's, I guess, obvious, but you don't often think about, we were able to get the occlusion right the first time. Now, I can do multi-quadrant dentistry in one visit. This Friday, I have a young man who's coming in for his first Soleil visit, and we're doing 2, 15, and 18 all in the same visit. We'll probably get the occlusion right on. He won't come back for a bite check. Think about what that's worth in your office. No one has to reappoint for a bite check. No one has to confirm the appointment. No one has to, greet the patient, sit them down, get them perhaps numb again for a tooth that's hot, that type of thing. You end up saving a lot in the long run just through the second appointments. And I'd like you to try this if you haven't already. If you, and not here, but sometime. If your hand falls asleep or if you make your hand fall asleep, try to pick up a pen or pencil or try to throw a ball. Try to do something simple like that. It is so difficult to do because our mind works in ways that we don't often think about proprioceptively. It just works. And that's the same thing that we've done to patients for years, and just accepting it as part of dentistry. It doesn't have to be that way anymore. We can be more reliable and get a better result in one appointment, and we can make kids smile from ear to ear. They don't have to be afraid of us anymore, and adults for that matter. So here's a frenectomy that we'll see. This is another video. This was done on a 6-year-old patient by Lawrence Cutlow, and you can see that this procedure is only done in a matter of minutes. It's done completely bloodlessly. You'll see maybe there's a little bleeding if you want to split hairs there, but the field of view is excellent. And it's done only with topical anesthesia, every time. I haven't given a shot for a frenectomy ever since I've had this lab for a year and a half. You can see how cleanly it cuts the fibrous tissue of the frenum. Oftentimes with the diode, you almost have to drag the diode through the fibrous tissue. But in this case, there's no dragging. And the most important thing to remember is patients need to have a great experience in your chair, but more importantly, they need to have a great experience at home. And they're thinking about you when they go home and they're hurting still. And you're getting phone calls probably because of that. So you can see the lack of morbidity right off the bat after the surgery. I'm here to tell you that surgeries heal twice as fast. They heal more cleanly, as you'll see here. This patient is a 76-year-old, came for an emergency visit, and you see the immediate post-op, how clean that is. I mean, it just absolutely beautiful, no sutures. We didn't have to give her a shot in the tongue. We just used TAC anesthesia, just topical anesthesia, and it only took 8 minutes. So you can see that 5 days post-op, it looks almost like a brand new tongue. That's normal. So I'll go through these. We're getting low on time. You can see another example of a beautiful healing case, and this is every single time. You can use it for uncovering wisdom teeth cleanly. I mean, of course, you get them done for that. You can use it for crown lengthening. It all looks like this afterwards. So these are just that's 4 days post-op, just some close-ups. So again, my name is Dr. Ryan Slayton. My goal is to use the Solea on every patient every day and change their life, change their respect for us, and change our profession. People don't have to say the things that they say to us anymore. Again, the last shot I gave was in November, that's the truth. Virtually every soft tissue procedure that I do is blood-free and use only topical. There's a variety of things that you can use it for, and there's more to come. As of next year, we'll be doing all kinds of other functionalities and handpieces. I do several more procedures a day because of the Solea, because of its efficiency, and I get several new patients every single day, certainly every single month. One of my favorite patients has told me that his son is a totally different child in the chair, and he calls the Solea voodoo magic. If you want to come see voodoo magic, come to the booth. It's at 941. It's amazing. It's the most amazing piece of technology I've ever seen. Thank you.